it would be really great to just pause a moment and have you explain how your technology works. Because as you're describing this, I'm sure that there are people listening going, wait a minute, how are you talking to them through the television? How are you monitoring them this way? So, take a moment and explain how does HealthyMed work inside the home for someone?
Happy to do that. So the way it works is once your case manager approves our services, we install usually a 50-inch TV. It might be smaller depending on room size and that. And we install that in the home. We also install RPM devices or remote monitoring devices. So that could look like a glucometer. It could look like blood pressure, a scale, thermometer, a pulse ox, things like that track your data. Then when we start with you, you have a health score with us that sits on your platform that you can see. And your health score relates to 4 categories, which is your device, your RPM device data, meaning if we say to you, okay, Rachelle, we need you to take your weight every other day, and we need you to take your blood pressure 4 times a day. Do you do that? You get credit towards your health score there.
So adherence.
The second piece is medication adherence. So are you taking the meds that you need, right? If we're talking about bending the cost curve, if we can just get you to take the right meds at the right time, it's a huge first step. In HealthyMed's clientele, our medication adherence rate is 63%, which is 39% over the state average. So that's a big step to what we do. But medication adherence rolls up to your health score. Then with your devices are you in ranges that are set by our clinical staff? So if your blood pressure needs to be in this specific range and you're in there, you get credit towards your health score. And then finally is our learning library, which we can go into in detail if you want. It's a separate library that is custom made for each client, and videos are prescribed by our providers to get them to help understand what their care is. So all of that rolls up to your health score. So day one, you're going to understand what your health score is, and now you have something to work towards and try to achieve. And what I can tell you is if their health score goes down 2-3 points, we get calls. Why? What do I have to do? I don't like that, which is really great. That's part of the engagement, part of what we do. We follow that up with our services, right? So we have nursing staff that is in the home 4 times a year with the client for primary care. So we do primary care visits in the home through telehealth, through the television, with a provider. And then the nurse is there to assist the doctor on, hey, I'd like to see this client move their shoulder a little bit because that's been sore, or I'd like to see their gait, or can you move their arm up so I can check that wound, those kind of things. So that happens. And then we also do behavior health. So behavior health is now done in the home. And so all of those services are a way to connect this population to services to help them lower their cost of care and to live a healthier, better life as well, right? And if we can do that, again, everybody wins. And that's an easy part of what it is. So while there's a lot of moving parts to make all that work, that's what our platform is. It's important to note that on the television, you can watch whatever you want to watch. You don't have to be on our platform. You can watch Hulu or the Super Bowl or anything else. And all of your medication reminders and your reminders pop up on the TV regardless of what you watch. So this is a opportunity for you to just have another device in your home that helps you, along with providing you an option to be able to watch TV and movies and all of that too.